Clear Up Health. Elderly man beaten and burned by nursing home staff for being gay, later passes away. Ted Brown said his now deceased civil partner of 50 years, Noel Glynn, received bruises and cigarette burns from homophobic workers while living in a London nursing home for 9 months. Brown sued the local council that oversees the home, and the council offered a $38,000 settlement to Brown 2 years ago, but he said he hasn't received any of the promised money yet. Glynn lived in the Albany Lodge Nursing Home in Croydon in South London from December 2018 to October 2019 while receiving care for dementia. Brown paid $1,787 a month for Glynn's care. Brown said 2 LGBTQ+ residents advised them to stay closeted, otherwise it would not be good for them. Brown became alarmed several months later when he discovered that Glynn had tried to independently leave the nursing home 4 times. Glynn told a social worker in January 2019 about the physical abuse he faced in the nursing home. A whistleblower at the home told Brown that he witnessed a staff member approach Glynn in the hallway and ask, "Are you a gay man? Do you like gay men?" They then dragged Glynn into his room, and everyone heard Glynn calling for help. Glynn moved out of the nursing home and into a new facility in October 2019. Glynn died in December 2021 after falling and fracturing his ribs. Okay, children.
Oof.
You know, the sad part is that this is not an exception, because I've been hearing things out of the corner of my ear about people in the United States going into nursing homes and going back into the closet. I will be the first to admit, working for a construction company, that I sort of kind of had to do the same thing, because when you work for a mom and pop furniture store where the lead designer is a gay man and very open about it, it's really easy to be gay in that kind of environment. But it angers me that well into the 3rd decade of the 21st century, this crap is still happening. And of course, I'm a little disappointed in that it was happening in England, which, by the way, had gay marriage before we did. And I only know that because I celebrated the marriage of my British friends in Newcastle, and hopefully they're watching. See you in September. You know, it just, I can't. Poppy said, I'm tired, because it's like, you know, I've always had a policy, and I developed this for myself years ago. I will never volunteer out of my own safety, but if I'm flat out asked, I'm going to tell you, because if you have the stones to ask, I'm going to have the stones to answer back.
Okay. Yep.
But at this point, you know, I am too old for this crap. Yeah. I am just too old.
Unfortunately, a lot of the aging LGBT community faces these kind of problems, especially in healthcare. And it's been well documented that there's a lot of abuse in nursing homes, a lot of abuse in elderly homes, specifically targeting LGBT elderly people. And another reason why is because a lot of LGBT people who are aging don't have support systems. They don't have families. They don't have, you know, people that they can go to if something goes wrong. You know, and that's why they take advantage of it.
This is so layered, right? Because the population that's going into nursing homes now, they didn't have family support back then, right? What we've tried to do with coming out and being proactive and changing and expanding the education system and changing even how we do healthcare, right? Accepting pronouns and all that, people, it becomes a part of their life, so that a lot more people now do have that family support.
Exactly.
Right?
Exactly.
So we have this crisis right now of, what are we going to do? This generation is here. It's the first time in humanity that we have an older out population. But because of resources, they're ending up in these situations where this poor gentleman got beat up, but I've been hearing for years about many older LGBTQ people that just choose suicide.
Yeah.
Because they can't even live back in the they ran away from home. They've been living in Fort Lauderdale their whole life. They're 70-something. They get sent back to Iowa or somewhere. They haven't been there since they ran away when they're 15, and they just choose to end it. This is not an acceptable way for us, especially in this country, to be at that point in our lives, right? We have to do a lot better.
I'm going to add a layer to that, because I don't know how true this is today, but certainly back in the day, it's like you know, we've all made the joke. I'm sure I certainly made the joke in my younger days about the troll. And, you know, it's like, it seems we hit a certain age and all of a sudden we disappear.
Yeah.
And it's like, you know, and by the way, follow the old gays on Twitter, or what's left of Twitter. X. There's a group of 4 old gay men.
Oh, yeah. I love them. I've seen them.
I love them too. But, you know, we need to start taking care of our own, and not just the younger ones, not everybody.
Well, yeah, that's what I was going to say. I mean, I think, you know, this story is not exclusive to the LGBTQ community. This is widespread. I mean, even in Miami, we've had many cases, and now they kind of put some policies and cameras in order now, so that it doesn't happen as much, because it's true what Poppy said, like, people are getting left alone. What's great about us is we do have organizations now that provide assisted living for LGBTQ plus communities, where you can volunteer and spend time with a senior LGBTQ folk. But I don't want to scare everyone and think like this is happening to all older, you know, LGBTQ folks. But the way that we combat that is by volunteering for, I think it's Lambda Living as well that does these kind of things. Because once you get a certain age, people start to die off and you're left alone and you don't have family, especially when you're from the older generation where you were ostracized. So I think we should focus on that, and maybe not focus so much on the fear mongering that this is going to happen to us when we get older.
Well, hopefully it won't happen to us, but we should also talk about that organization, SAGE, because a lot of what SAGE does is they go in and they train the nursing home staff who didn't know. I mean, they just didn't know, right? But now they know. Now there's a resource. Now you do not have any excuse. If you work in healthcare, to me, when you have a vocation like healthcare or like education, you're kind of born with it, right? You want to help people. So for you to be that type of person and then to abuse a patient doesn't even make sense to me. It's like
the Hippocratic Oath. Like, what are you doing?
And you know,
like, well, what are you doing there? Like, how did you end up in a place to take care of people?
And we've only been putting people in nursing homes really on a massive industrial scale for about 50 years. You know, I remember as a kid, I was a dork. I was watching 60 Minutes on Sunday nights, and I remember as a kid seeing, you know, like these nursing home exposés, and this wasn't an LGQ thing. This is just an aging problem that we don't have people to take care of our older people, and this person fortunately had a partner who was able to intervene and stop. But we're at, you know, especially right now, because the current younger generation, a lot of them are going to have kids of LGBTQ. You know, we're going to have kids and things like that. But the current generation that's starting to go into nursing homes right now and have been there at the early onset of baby boomers, they don't have anybody to watch their back. And before we move on, I just want to say, this person, or the people who were abusing these seniors at the English place, they're not homophobic. I don't even like the word homophobic, because they're not afraid.
They're scared,
Phobic means that they're scared. There's not homophobia. This is just vicious bigotry, start to finish, case closed. And we have to, like you said, SAGE is a great resource, and there are others. There are Rainbow Services here in South Florida. Come in and do semi-assisted living. They're there during the day until the partner can come home, and they are specifically LGBTQ+. It's sad that we have to continue to create our own community at every level, but that's what we're doing.
SunServe runs a senior daycare in the other building.
Right across the patio from us. So services are out there, and I encourage you, even if it's one of your friends, if you're, you know, a partying 35-year-old, but you know someone who's around 70 and starting to get a little
Your neighbor down the hall.
Your neighbor down the hall. Look out for them.
we're our family.
Do some research for them.
Yeah.
Find a place. Not, it doesn't even have to be to warehouse them, for lack of a better term.
Yeah.
It can be to find an assisted living. You know, we've got the what is it at Pride Center? There's 55 units for senior living, and it's all income, or at least most of it is income-based rent for our LGBTQ plus seniors.
We had Lambda Living had a program on the beach, down in South Beach. And so I had a lot of my older neighbors and patients who were LGBTQ, and they would come and pick them up in an event. And they would bring them for the day, and they would get, one day they'd watch movies, the other day they'd play dominoes, the other day they would play. They were having a ball 5 days a week. At least they got them out of their apartment because they were so isolated. They were so depressed.
Exactly. And it doesn't have to be a big to-do. Like you said, box of dominoes, a streaming subscription to Turner Classic Movies, and you watch an old school movie. Anything like that.
Never underestimate how much these older people can be card sharks, because my grandfather, no, seriously, my grandfather, days before he died, took everybody's money at the pinochle table.
Pinochle. I haven't heard pinochle in a long time.
We are Queer News Tonight, the world's first and only live daily LGBTQ+ evening news show, brought to you from Happening Out Television Network. We operate in the same model of PBS and NPR, but for the LGBTQ+ community. We educate, inform, and entertain by supporting the 10 pillars of our LGBTQ+ community, with more than 100,000 a week watching us on Roku, Apple Television, and other channels. To keep the story going, we accept donations with 100% transparency. Stay updated and live authentically with Queer News Tonight.